Good evening. Hello, and thank you for joining us. My name is AJ Ehrenstein, and along with Nikki Youngblood-Giles, I serve as Dean of Beyond Barnard. Our team at Barnard supports all students and alumni as they define, pursue, and achieve success in their careers and communities. Welcome to the fourth installment of Insights powered by Barnard. As we get ready to start the fall semester, we know that events like these represent the best of the college, incisive conversations that cut to the heart of the most important issues of our time. And during this precedent-setting time, the Beyond Barnard team joins with the rest of the college in saying that we're here for you and for the entire community, and we're excited to work with you virtually this semester. Some quick housekeeping for tonight's attendees. As always, this event is being recorded and will be shared next week. Attendees will not have microphone or camera access during the event. Attendees' voices, likenesses, and images will not be captured by Barnard College. Written submission of questions may be shared during the Q&A portion of the event. And with that in mind, I want to thank everyone who submitted questions in advance. We will do our best to get to as many questions as possible. It's now my pleasure, as always, to introduce the 8th president of Barnard College, Sian Leah Beilock. President Beilock has led Barnard since 2017, having served for 12 years at the University of Chicago. She is one of the world's leading experts on the cognitive science behind choking under pressure and performance anxiety, with a focus on math and science for women and girls. She's the author of 2 critically acclaimed books called Choke and How the Body Knows Its Mind, and her 2018 TED Talk has been viewed over 2 million times. Please join me in welcoming President Beilock.
Thank you, AJ, and welcome to all of you. And I want to have really a special welcome to our Barnard parents and families. Some of you who are joining us for the first time, I'm so pleased to have you here this evening. Before we start, I really want to express my excitement about the start of classes in just under 2 weeks. I know it's not how any of us wanted to start, being virtual, but I really do believe this pause for the fall is the shortest path to making sure that we can join each other together in a safe and healthy way as soon as possible. I also want to say that whether you're in Morningside Heights or across the country or across the world, we're really going to be here for you to connect with you. Whether it's alumni circles, where students can meet other students and alums in their area, or through different series and experiences we'll have on campus, and of course, through your classes. We're especially excited for first years that they'll all be taking part in a new curriculum experience called Big Problems, Making Sense of 2020. It's going to be a really fantastic experience where you'll be hearing from some major thought leaders across the country, and then getting to put to use that knowledge in terms of how you're thinking about the world today. And of course, outside the classroom, we have a new initiative called Third Space at Barnard, where students are actually going to get to learn from and connect with practitioners in their area, individuals who are affecting community engagement, affecting government, changing how sustainability happens in their community. We're so excited for students to work with these individuals and learn and develop projects on their own. So with that, let me talk a little bit about this Insight programming. These have become a regular part of our summer connections, and they will continue throughout the next year. It's really a glimpse into the kinds of conversations that take part at Barnard and with Barnard students and alums. And we're so excited for what is to come both tonight and in the upcoming year. Really, what Insights does is allow us to hear from extraordinary female thought leaders who are changing the way we think about our careers, our place in the world, and how activism comes together with passions in different ways. And with that, that certainly helps us describe and helps me describe our guest and speaker for tonight, our alumna, Dara Richardson-Heron, class of 1985. So Dara is pretty extraordinary. Dr. Richardson-Heron is currently the Chief Patient Officer at Pfizer. one of the world's leading research and global biopharmaceutical companies. And her role is to ensure the implementation of patient-centric strategies. And I think we're all going to be learning a little later what a chief patient officer actually does. But before her work at Pfizer, Dara served at the National Institute of Health as the Chief Engagement Officer and Scientific Executive for the research program All of Us. At NIH, Dara worked to build relationships with community partners and raise awareness of All of Us, which is really an interesting program aimed at enrolling, engaging, and retaining 1 million volunteers in a landmark research study designed to advance innovative health research. With 25 years of research, of leadership and management experience, Dara brings a wealth of knowledge from across the healthcare, corporate, and nonprofit sectors. She was Chief Executive Officer of the YWCA USA from 2008 to 2012. And then she served as CEO of the Greater New York City affiliate of the Susan G. Comer for the Cure Foundation. These are among her many other roles at institutions like the United Cerebral Palsy Association and Consolidated Edison. Dara is a physician trained at NYU Medical School and is a 23-year-old and counting survivor of breast cancer. Dara brings a distinctly multifaceted perspective to her advocacy for inclusive patient care. We're so proud that Dara graduated from Barnard with a degree in biology, and she's remained an active, committed alumni of the institution, serving as a distinguished guest speaker at the 126th convocation in 2005. We're also excited that Dara is a member of our Barnard Board of Trustees. I'm so delighted to welcome Dara to Insights tonight.
Thank you so much, Sian. I'm delighted to be here.
Dara, thank you for joining us. And first, as always, how are you doing and how have you been managing over the last 5 months?
Well, you know, Sian, it's complicated, but thank you for asking. And also thank you for the wonderful opportunity to join you today. You know, I'm really excited to be here with you virtually, though I'm wishing we could have been together in a beautiful Shirley Philip Milstein Center or the Diana Center. But you know, as for how I am doing on the whole, my family and I are doing very well. In fact, you know, let me be clear, we're blessed beyond measure. And, you know, despite the unbelievably surreal circumstances and realities that we're all facing on so many fronts, you know, I'm managing. You know, I wake up every day grateful for the things that I do have. But, you know, if I have to be honest, I have to tell you, I'm deeply troubled about the state of our world, you know, the historical injustices that have generated social, economic, political, and ecological upheavals, as you have so eloquently put it. And let's face it, I don't think any of us were expecting 2020 to look this way. I know I certainly wasn't. And I guess one of the things that's troubling me most is that there is a new normal that we're all waiting for. I mean, that's kind of the understatement of our lives. But, you know, in fact, at least for me and my family and the people I'm around, our lives have already and will continue to change in ways that are unimaginable. But, you know, I was just thinking about it, you know, I welcome a new normal. In fact, it's my hope that we don't go back to business as usual because you know, it's unequivocal that our recent world events have made things worse. But if we are truly honest with ourselves, we have to admit that there are a lot of things in our world that were broken for a long time before the pandemic. And I think the pandemic just highlighted some systemic and institutional failures in our nation and just put a spotlight on the brokenness. But I'm optimistic. It's a long way of saying I'm doing well. I'm sad that America that we love so dearly doesn't always love us back, but I'm optimistic that, and I guess I'm optimistic because I really feel like this is an opportunity for us to put forth our best efforts so that we can come out of this stronger and hopefully much more resilient than ever.
Well, I love your talk about resiliency and really seeing the truth in a situation, figuring out how we can change it. I think that's a true Barnard attitude. So before we get to some of what you're thinking currently, I'd love to step back and actually talk about your road to Barnard. So you went from Oklahoma to Barnard. We have students who come from all over the country and the world, but I'd love to hear a little bit about how that happened.
Yeah, and I'm not sure if I like how you said Oklahoma. That's my hometown now, but you're.
I just meant it in distance.
Okay, I don't know. There was a little accent on it, but I'm gonna move forward. But you're right. I came to Barnard from Oklahoma City in 1981 because you know what? At the time, Barnard had the highest percentage of students who successfully matriculated into medical school, and I was laser focused. I do mean laser focused on achieving one of my career goals, and that was to become a physician. But you know, I also selected Barnard because of Barnard's incomparable and rich legacy as a leader in higher education for women. I remember being told at freshman orientation, and I quote, Barnard women changed the world and the way we think about it, end quote. And, you know, it was at that point that I knew for sure that Barnard was the right place for me.
Well, let me reassure you that we're still one of the top producers of women going on to medical school. And actually, Barnard is in the top 10 of all institutions in terms of the percent of female PhDs we produce across the sciences. So it's really exciting.
That is exciting.
And I think now more than ever, we need women in the sciences and diverse perspectives, right, to come up with the best ideas and solutions.
Yeah, I just saw an article, interestingly enough, in the New York Times, and still physicians of color are only 5% of the physician population, and then women only 2%. How could that be? I mean, it's just not right, but that's a topic.
So we're going to work to change it. So you're a biology major, but Barnard obviously offers a really broad education across the arts and sciences. Tell us a little bit about the value or the value that you might have experienced outside of your science classes. How does that shape who you are today or how you went off to medical school?
Well, you know, what's interesting, you know, certainly, yes, you're right. I majored in biology, and while a biology degree does open the door to many career possibilities, you know, as I mentioned, I was laser focused on going to medical school, but that's why the biology major made sense for me. But I knew in order to be an exceptional physician, I needed to learn about not only the human body, but I also needed to, you know, have a liberal arts curriculum at Barnard, you know, which made me, I think, a much more well-rounded person and physician. You know, as you know also well, you know, the liberal arts education that we receive at Barnard, you know, kind of just opens your mind to other perspectives. It forces you to think critically, realizing that the world is really complex and there's almost never a one-size-fits-all approach to any issue or problem. And I will tell you, you know, some of those lessons that I learned, those have been life skills that have paid enormous dividends for me. So, you know, the combination of obviously my biology degree, but, you know, that liberal arts education, I think, really has served me well, and it's been providing me with skills that I've been able to use throughout my life and career.
So do you have a favorite class outside of maybe some of your science classes? What pushed you to think outside the box? A humanities class or an arts class or a social science class?
You know what, I think it was a combination of all of them, but also being in New York City, because I think the thing about Barnard is that your education comes not only from your classwork, but it comes from spending time getting to know people from all around the world, both in your classes, but also in New York City. So I think it was all of the above for me, certainly. I certainly have a course that was my least favorite, but you didn't ask me that. But, you know, don't even mention
all right.
Organic chemistry for me. That's a sore topic.
That was a hard one for me as well. Yeah, I love this idea of meeting so many different people, and just the idea that Barnard attracts students with really different experiences, different lived experiences, different mindsets, different viewpoints, different political ideologies. It pushes you to think in different ways. And I always talk about how when you have to defend your opinion to someone who doesn't agree with you, whether or not they change their mind or you change your mind, your ability to think about it gets better.
That's absolutely right.
Yeah. So you say oftentimes, and I've heard you say this before, you're a doctor by trade and an advocate by choice. Can you say more about what that means to you? Because I think that's fantastic.
Yeah, I definitely describe myself as a physician by trade and an advocate by choice. You know, I did my medical residency at Bellevue Hospital, which, you know, as you know, is the oldest public hospital in the United States. And in many ways, it provided an inflection point for me, because it was at Bellevue where I actually saw patients, many who through no fault of their own presented with late stage and often incurable disease. And, you know, for years, you know, I learned about health disparities in academic settings, but now here I was on the front lines, seeing health disparities play out in a real way. And it was often because people had little or no access to care. And I was also at Bellevue at the height of the AIDS epidemic, even before it was called AIDS, and I'm dating myself there, but, you know, we had very limited treatment options, and tens of thousands of people were dying every day all around the world, much like what we're seeing with COVID. And it was, I remember, it was a devastating time for me, but as I look back, I think it was also an aha moment for me, both personally and professionally, because, you know, I realized that, you know, I was determined to create an impact in the world much larger than what I could do in a traditional clinical setting, which was the norm at the time. I knew that I needed to make a bold move and chart a very non-traditional path in medicine, so that I could contribute not only to the medical profession, but to society as a whole. And there was no roadmap for this. But I still followed my passion. I was determined not only to figure out a way to decrease the burden of disease, but also to connect with and be an advocate with and for patients. And I say that, you know, with emphasis, with and for patients, especially those who were unable to advocate for themselves. And so that's why I describe myself as a physician by trade and an advocate by choice.
Yeah, I love always hearing about the moments that changed people's ideas and their trajectories, but it's nerve-wracking to take a different path. And certainly, you know, from being a biology major and coming to Barnard to think about medical school and going to medical school, you had a kind of a set path. How did you get up the courage? Were you discouraged along the way? I mean, I think we often look back and see people who are successful and we don't realize how difficult it was to get to that point.
Well, you know what's so funny? I wouldn't say I was discouraged, but it certainly wasn't the norm at the time for someone to go through and get a doctorate of medicine and do a residency and then begin thinking about other options besides being a traditional physician with an office or a private practice. But if you recall back in those days, managed care was coming into play. Insurance companies were playing a much larger role in health and healthcare. And so I just, talked to my mentors and I said, I want to do something different. And I wasn't even clear what it was that I wanted to do, but I knew what I didn't want to do. And so I made a bold move, which is something that I often do. And I talked to my professors and also some of my mentors. And I told them, I said, I want to do something different. I'd like to leverage my skills as a leader, as an advocate, as a physician, but I don't think I want a traditional practice. And actually, excuse me, one of my mentors, Dr. Saul Farber, he said, occupational medicine might be the right thing for you. And at that time, I didn't have Google. So I had to go to the library and actually get out a book and figure out what occupational medicine really was. And it was essentially, running a healthcare system in a major company, corporation, disease management, and things of that nature. So that was my very first job. So while I didn't get discouragement, a lot of people did look at me with the one eye and say, wow, you did all this and you don't want to have a private practice. But I don't let other people kind of box me in that way. I always kind of think about the things that I'm passionate about and where I feel like I can make a difference. And certainly, while I've been a non-traditional physician, I think that 25 years of my career spanning leaders in for-profit companies, non-profit, government organizations, as you mentioned, from Con Edison to United Cerebral Palsy to Susan G. Komen to the YWCA, and most recently, before I joined Pfizer, the National Institutes of Health, I've been able to carry the diverse learnings that I've gleaned from each of those experiences with me, and certainly the collective experience informs the work that I'm going to do at Pfizer, and I'm currently doing as Pfizer's Chief Patient Officer. So for me, it's all about continuous learning, continuous growth, continuous impact, but making sure that I'm personally passionate about what I'm doing.
So talk to us about what you're doing at Pfizer. What is a Chief Patient Officer? I think a lot of us have that question. We'd love to know more about what that actually means. Is this a common title?
Well, you know what? Just about every pharma company today has a version of the role. It may not be called Chief Patient Officer, but just about every company has someone in the role doing the work. And as for what a Chief Patient Officer does, a Chief Patient Officer is singularly focused on identifying, amplifying, and creating a strategic framework for impactful interactions with patients, sharing learnings among groups, finding new collaboration opportunities, both internally and externally, and also informing and refining best practices for how to co-create solutions by working, again, with and not just for patients. So, this work is so important and it's necessary. And while a culture of patient centricity or patient focus needs to be embedded in the DNA of all employees, I think it's important and in my view, imperative to have a leader in the organization for whom respectful, authentic, bidirectional, and authentic patient and community interactions are the singular focus. So think about it, as we develop medicines, treatments, or vaccines, if we don't involve the patient, without this direct input and participation of patients and patients from all walks of life, it's very hard to ensure that the developments and the medications can actually benefit all patients. So that's why, and I'm very happy that Pfizer is very intentional about having a Chief Patient Officer who can engage with and partner with patients, caregivers, and patient advocacy organizations and other key stakeholders so that you can really figure out ways to put the need of the patient first and at the center of our efforts. Think about it as consumerism for patients, I think that's one good way to think about it.
And always having a voice and having someone who's advocating on their behalf, right? Because you could imagine that could get lost in the room when a lot of other interests are at play.
That's absolutely right.
Yeah, I love that. So you spend a lot of time, you're in the C-suite of, a major corporation. Tell us a little bit about that and your experiences in other leadership roles, just as a woman and a woman of color. I think, we often think about being the only person like us in the room. And you talked about the statistics about doctors who were doctors of color and especially women. And I think those statistics, as we know, play through on boards and in upper management in many major companies. I'd love to hear just a little bit about your experiences and some of the things that maybe tips or other things that as all of us think about taking on roles that we maybe don't have so much comfort in or taking new steps, how we think about that.
Yeah, that's a great question, Sian. You may have realized I'm a bit of a storyteller, so I'm just going to give an example. I mentioned my first professional role at Con Edison, the electric company, and I started out as an administrative physician in the company's occupational health department, and we were providing health evaluations and disease management for more than the 16,000 employees at the time. But in that role, I not only practiced medicine, but I also learned really important leadership, business, financial, and human resources, and even management skills, which have really been valuable for me. Now, remember, I was fresh out of residency, full of energy, and after a year or so on the job, I heard about the company's high potential program for high achieving employees. And as time passed, it became clear that many colleagues were being considered for the program, but not me. So one day I actually raised my hand and I directly asked, why wasn't I being considered? I had done well. I was achieving. I was, hitting marks at, and doing things and creating programs. And I said, why am I not being considered? And one of the executives, who actually later became a great friend and mentor of mine, she said without hesitation, listen, Dara, you already have a doctorate of medicine. You don't need any higher title or additional development. So I have to admit, I was surprised by her candor, but I was also deeply disturbed. And I think I was disturbed most of all because she and apparently others had taken the liberty to make a decision about me and my career advancement without the respect or courtesy of even checking in with me. So as the Barnard woman that I am, I very respectfully, but clearly let her know that neither she nor any other company leader has the ability to put me in a box or put a limit on my confinement. I mean, yes, I became a doctor, but that doesn't mean that I'm finished, washed up. So here's the takeaway. I mean, advancements have been made, yes, but still today, as a woman, and certainly as a woman of color, you often have to raise your hand and say, hey, I'm here. Do you see me? Consider me. That's just the reality. And yes, for those who are wondering, I did get into the high potential program, and ultimately, as a result, I became a special assistant to the CEO. That's just one example of kind of the life in the day in the life of a woman of color in leadership. It's complex, but I think the thing that keeps me sane is that even if I am the only, I just ground myself in knowing that there's a reason why I am in the room. So I need to make it count.
I love that. It's, in psychology, we talk a lot about self-affirmations and this idea that actually we can focus on why we should succeed, and it changes how our brain functions. And that sort of reminder and self-affirmation can be powerful, right? It can lead you to raise your hand and do it and contribute in a way that's so meaningful.
Yeah,
I also love this theme that you've been talking about where, go on.
No, you go ahead. I'm sorry.
No, I love this theme that you've been talking about when you decided that you were, maybe wanted to follow a non-traditional path. You talk to everyone, you ask questions. It's sort of a constantly raising your hand and pushing in that way. And rather than waiting for people to come to you, always taking that step forward. And I'm sure it was sometimes uncomfortable.
Yeah. Yeah, but, I think sometimes if you don't, people will be very comfortable, just looking right over you, and you'll never get selected. And I think it's also important for you to be proactive in your life and career. After all, we only have one life to live. I mean, you got to make it count. So, if you know what your passion is, and that's a key thing, you got to figure out what your passion is and what you're passionate about. But once you do, you got to go after it with a vengeance, because, you can't wait for someone to kind of serve it up on a platter for you. It doesn't happen generally, and particularly for a woman of color.
It's good advice for all of us to hear, and a reminder that we're our own best advocates, and we have to advocate for ourselves. And, there's a theme that's running through this also about advocating for others, right? And it sounds like that's a lot of what you do. And I'd love to turn to your experience at NIH and hear a little bit about the work you did there. I think what has always struck me about the work you've done is that you're really taking a step back and pushing for an inclusive and equitable research arena in terms of how we think about recruiting participants and supporting them in medical research. Tell us a little bit about that.
Yeah, so just prior to joining Pfizer, and I joined Pfizer in February of this year, I was the Chief Engagement Officer and Scientific Executive of the All of Us research program at the National Institutes of Health. And as you mentioned, the goal of this initiative was to engage 1 million or more individuals to increase diversity in biomedical research and build one of the world's largest diverse and valuable patient databases. And databases to help researchers better understand and hopefully address the many health disparities. And then also, very importantly, to ensure that future medical advances benefit people from all backgrounds. And so in order to achieve this goal, yes, I was a staunch advocate. We built trusted, respectful, bi-directional relationships with patients and patient advocacy organizations, and we listened to them, making sure that the patient voices were and continue to be amplified, as you mentioned earlier, Sian. And we also engaged diverse grassroots advocacy organizations as our true partners. And what do I mean by this? We didn't just check a box and say, yes, we're going to bring on some organizations and help us. We actually invited leaders of grassroots community organizations and patients to serve at the highest levels of our organizational leadership and governance on our executive committee, on our steering committee, our advisory committees. And they were equal partners with our scientists in the decision-making process for the design and operationalization of the program. And that's not that common, because a lot of people check a box and say, yes, we connect with these advocacy groups, but it's a whole different animal to have them sitting at the table and being part of the development of a program. And certainly in my work at Pfizer, we know that equitable and inclusive research design are extremely important. And we also know that race, environment, ethnicity, culture, age, gender are all factors that can impact patient outcomes. So the problem is that historically many individuals haven't been sufficiently represented in clinical trials. And the reasons for that are multifactorial, but I'm just going to give you one statistic. For example, African Americans count for about 13% of the United States population, but they make up only 5% of clinical trial participants. Similarly, the Latinx population is comprised, over 16% of U.S. populations, but make up only 1% of clinical trials. And, the disparities are similar for Native Americans and other racial and ethnic groups. But here's the problem. This underrepresentation makes it so much more difficult for researchers, for regulators, and for physicians even to understand the extent to which a medicine can help certain subsets of the population. And this is really not okay. Because as I always say, if you're not part of the research, you may be left out of the cures. And there are many known barriers for participation in research, including a lack of trust given historic transgression. But I think we really have to do everything we can to make sure that there's diversity in all aspects of our lives. But as we talk about health disparities, there's got to be that connection, that strong connection between participation in research and the development of treatments and procedures that will be impactful for all Americans.
Yeah, and it seems ever more important right now during COVID-19. And I mean, I think, something you mentioned earlier about how not wanting to go back to the normal, where those health disparities have existed for so long, but a light is shined on them right now. What do we do? How do you work with policymakers? How do you advocate so that we can not go back to what the normal was and to address some of the health disparities that are really affecting disproportionately Black Americans, Latinx, Native Americans?
Yeah, gosh, Sian, if I knew the answer to that question, I'd be in good shape. But I want to share a phrase that I've heard a while back, and I think it's very interesting. It says, systems are the way they are because somebody benefits from them being that way. Now, that being said, I think we are all well aware of the many institutional and structural barriers and systems that hold people back from accessing quality health care. And for me, the path forward is that we got to address that first. People have to have access to care. I talk about my Bellevue experience when people came in with late stage masses simply because they didn't have health care, right? But in addition, I think we have to change the dynamics. You know, there was a time when there was a lot of trust in physicians, right? And that was back in the days of my grandparents. Oh my God, their general practitioner, what it was at the time, this guy was like a god in our family, right? I mean, it was amazing. I mean, this guy, he was a go-to for everything, not even just healthcare, anything major. They trusted him literally with their life. But for a really long time, I think doctors were really paternalistic, dictating everything patients did, giving them little opportunity to provide input into their healthcare and decision-making. But this whole idea of healthcare consumerism, I think, is emerging, albeit slowly, but it's important. Patients are taking an active role in demanding to be involved in their healthcare. So when you think about it, when you look back, there was a clear arrogance to the paternalistic time, but you know, the pendulum is beginning to swing, and some physicians love that, some don't. Some think that it's kind of going too far. I mean, I've heard somebody say, don't confuse your 10 minutes of Google research with my 10 plus years of training. I thought that was kind of funny, but I think we can all agree that there needs to be a balance between, you know, the healthcare providers and patients, and certainly COVID has shown us the importance of, you know, changes in policies, changes in practices, and honestly, changes in systems that must happen in order for everyone to have equitable health care. You know, truly, I think the pandemic is going to be a litmus test of what Americans actually want from their healthcare system, both in the immediate future and in the years to come, and even the decisions on how a vaccine is distributed and who gets priority for the vaccine. It's going to be telling of where we are headed as it relates to health equity in our nation. But as for right now, I agree with you. It's time to make it clear. The yearning for return to normal needs to clearly take into account the reality that normal is not the state many Americans want to return to, especially when it ignores the long-standing disparities in care and access that fall hardest on people of color.
So how does a company like Pfizer or a pharmaceutical company view themselves in this pandemic and think about some of these issues? Do you think it's changed?
Oh yeah, I do, and I think actually in a good way. I mean, you know, for years, pharmaceutical companies, when I was thinking about coming and taking the role at Pfizer, you know, there were just a few people who said, well, why, you know, you really want to work at a pharmaceutical company? I'm like, yeah, I do. You know why? Because a lot of us are alive because of the great things that come out of pharmaceutical companies. And I still, to this day, you know, don't understand how the general population at large doesn't recognize how valuable pharmaceutical companies are. And I think what the pandemic is doing is it's creating a brand new look at pharmaceutical companies. And I think pharmaceutical companies are even viewing themselves differently. And, you know, in fact, there was an article in Bloomberg News just this morning on the topic, but our leaders did some polling on this topic at the onset of the COVID crisis and saw that public perception of pharma has significantly improved. People are much more aware of the industry's efforts to discover and develop a safe and effective vaccine. And that is leading to more favorable perceptions of the industry across the board. And certainly at Pfizer, our CEO, Albert Bourla, he put a stake in the ground, declaring that we would be part of the effort. And he challenged our teams to develop a vaccine candidate as quickly and safely as possible. And, you know, given the gravity of this crisis, you know, our development teams are certainly not operating under the assumption of business as usual. It's full steam ahead. And it's important to note that we are not cutting any corners on the vaccine safety and efficacy. So, you know, I think what the pandemic has done is, again, shone a bright light on the organizations and the companies like Pfizer and others, who as an industry have the capacity to change us from where we are now. And if we can meet society's expectations at this time of need, I think we stand to build even greater trust and respect with patients and the public. And I think this will in turn lead to a significant and hopefully sustainable change in the perceptions of our industry.
And it seems like from your role, more input and continuing input from patients in terms of what's happening in the industry, which seems fantastic. Okay, so we're all curious about this. Can you give us any updates on the progress of a vaccine? I think we're all, waiting and reading and trying to understand all the information out there.
Yeah, actually I can. As many of you may know, in March, we announced that Pfizer and our German partner, BioNTech, were beginning a global phase 2/3 safety and efficacy study on a vaccine candidate. We received the approval from the FDA along with other regulators. And so our trial moved forward with the goal of enrolling up to 30,000 participants between the ages of 18 and 85, and a diverse population drawn from regions where one could expect significant viral transmission. And I'm excited to say that as of this week, study enrollment is more than 50% complete. And here's the really great news. Approximately 19% of the study participants recruited in the United States were Black or Latinx. That's just amazing news. And so the timeline, as you might imagine, is ambitious, really ambitious. So if this trial is successful, we expect to be ready to apply for some form of regulatory approval as early as October. And after obtaining that approval, we're planning to ramp up in production. And the goal right now is to be able to produce up to 100 million doses by the end of 2020, and as many as 1.3 billion with the B doses by the end of 2021. And so, we're excited. And I want to reiterate that safety was, is, and will always be our #1 priority in vaccine research and development. Even though we're moving forward with extraordinary speed, preservation of high quality and safety standards is critically important throughout our development. And so, we're excited. We're really looking forward to good news.
Good. So are we. But you talked about this a bit. And until we have enough vaccine for everyone, how does the whole pricing and access, how do those decisions get made, and how do you think about it? What sort of information that we as the lay public here should be thinking about as we read about what's happening around access, pricing, other aspects related to the vaccine?
Yeah, that's another complicated question, Sian, but let me just be clear that Pfizer's goal from the outset has always been to bring a safe, effective, and affordable vaccine to combat the pandemic, and as soon as possible. And so we've been committed to working with the government and payers in an effort to ensure that affordability will not be a barrier to our vaccine. And to that end, we've established pricing principles for our potential COVID vaccine, which are consistent with Pfizer's values and missions to bring breakthroughs, and our tagline is that change patients' lives. And, I think we can all agree these are extraordinary times, so our pricing will reflect that. During the term of the pandemic, we're planning to price our potential vaccine consistent with the urgent global health emergency we're facing to ensure that there is widespread vaccination for all countries. Secondly, we're very pleased that the federal government has announced that the COVID-19 vaccines they purchase will be free to all Americans. So based on the agreement, the federal government, yes, will produce and distribute doses of potential COVID-19 vaccines. And because the vaccines will be purchased by the U.S. government during this pandemic phase, they've announced that there will be no cost for vaccines to individuals. So, the federal government is also working to ensure that fees to healthcare providers for the vaccine administration are covered, whether the patient has insurance or not. And just one last thing, I just want to flag that the Pfizer also continues to support legislative and regulatory action to lower the cost burden for patients. This includes efforts to cap out-of-pocket costs, lower beneficiary cost sharing in the Medicare program, and also to incentivize the use of lower cost alternatives, like what we call biosimilars. So, we're excited about, making sure that we're doing our part to make sure that America has a vaccine.
Well, I know we're thankful for the work that everyone is doing as they work really hard on getting us a vaccine and treatments that work. I think it's so important. So we have lots of questions from the audience. I'd love to turn to some of them. The first one I have here is from one of our first years, our newest classes, Katerina Kaganovich, of class of 24. She asked, what do you wish you had known as a young professional that would have helped you later in your career? Which I think is a fantastic question.
Well, thank you, Katerina, for that question. It's funny, I mentioned earlier that, it's so important for leaders, and particularly women and women of color, to raise your hand and sign up for bold and out-of-the-box, non-traditional opportunities. But as a young professional, I developed what has been coined now, I've learned, is a serious case of quote-unquote helium hands. So this term was actually coined by Dr. Pamela Peeke. She has a book called Bodies for Life for Women. And so helium hands refers to the phenomenon that many women like myself experience. We take on way too much. Our hands upward almost involuntarily to sign up for yet another project despite already having a full plate. So perhaps as a young woman, if I had known the disease of helium hands was incurable as a professional, I might have made sure not to catch it. Or at least I would have developed the muscle by now to figure out, when to say no much more often. And, I say this a little bit tongue in cheek because I really do believe that you have to raise your hand, you have to be part of it. But I've achieved a lot of success in many areas of my life, but my work-life balance has never been my strong suit. And a lot of it has to do with my determination to succeed and also just the realities of being a woman of color. But the truth is no one is expendable, and it's just not healthy to always burn the candle on both ends. So I think if I would tell my younger self, maybe, reach up, let those helium hands go up, but maybe be a little bit more strategic about, saying yes to everything. Because, if you say yes to everything, it'll almost certainly force you to have to say no to something that might be even more important. And really, quite frankly, at the end of the day, saying yes to everything leaves you exhausted.
Yeah.
So,
yeah, you talked about work-life balance. Do you have any tips during the pandemic as we're all, on our Zoom, and what do you do to have that balance?
I'm going to have to plead the fifth on this one because you need to get work tips from somebody better than me. I have not achieved it. I was just telling someone, now because I'm not traveling as much, I can do 2 to 3 conferences a day, and it's just not good. So I am not the one to go to for work. That I need to be asking somebody else that.
All right. Well, we'll make sure to have an insights where we have an expert on that, and we can both learn.
Okay.
So I have another question from Robin Hill Booten, who's the class of 87. She says, I'm a physician trying to transition to non-clinical status. What options are available? And tell us a little bit more about how one might do that now in the current times.
Yeah, Robin. Well, first of all, I just want to say, certainly now it's very common for a doctor to have, to not be working in a clinical setting. Unlike when I was having to chart the course back in my day. But I think there are many ways to apply your doctorate in a non-clinical setting. Think public health, medical technology, regulatory agencies like the FDA and other places, health insurance companies, nonprofits, hospitals, consulting, of course, biopharma, the list goes on and on. I think for me, and this is the strategy I use, I think the best approach to figuring out what non-clinical position is right for you is to make sure, and this is the thing, follow your passion. Write down the things that you really want to do. Remember I mentioned, when I was starting out, I didn't know exactly what I wanted to do, but I knew the things that didn't interest me. So follow your passion, decide what things really interest you, and work with your mentors and your sponsors or people who are in those careers and ask them how they got to where they got to. And of course, as I mentioned earlier, think big and be bold and don't let anybody try to limit your potential or put you in a box. If you want to do something that's completely not related to medicine, do that. I mean, I think you got to follow your passion.
Yeah, I think that's great. And I love this idea of not knowing exactly what you want to do, but figuring out what you don't like. And I think that's why oftentimes, at Barnard, we're always talking to students about trying something they haven't tried before. It's totally fine if you don't like it. It narrows the path of it.
Absolutely. It does. Yeah.
Okay, so we have a question from another student, Fatuma Wagu, who's a class of 22. So her question is one that I think a lot of us have. You're so motivated and passionate, and you talk about following your passion, but how do you avoid burnout? And she talks about her experience as a Black pre-med student and some of the being aware of health disparities and really how do you fight things like imposter syndrome to be able to raise your hand, to be able to say, what about, me here, and you should consider me?
Well, first of all, thank you for the question. It's really a great question. And I certainly don't want to be Debbie or Dara Downer here, but the fact is, while it's thankfully not an everyday occurrence, there are times when I am actually not motivated. And there are times when I am burned out. And there are also times when I am extremely discouraged and overwhelmed. The reality is that being a woman and a woman of color in the United States, it exposes us to sexism, racism, and microaggressions on a regular basis, all of which can weigh us down. There was actually a sobering article in the New York Times just like a week ago, and the title was, "For Doctors of Color, Microaggressions are all too familiar." Certainly events and current events have made it perfectly clear that our world is far from perfect. I think it's safe to say that we are by no means living in either a post-racial or an equitable society, but I stay motivated by staying connected to my faith in God, by leveraging the comforts of my family and my friends, and also by making sure that I am personally doing everything I possibly can to make a difference in the world. Sian mentioned earlier that I am a 23-year and counting breast cancer survivor. And at the time when I was diagnosed, it was not likely that a woman diagnosed as young as I would live 5 years. And here we are 23 years later. I take each day very seriously. And I want to use whatever time I have left on this world to make a difference. And so that's what motivates me. That's what grounds me. And as for trying to avoid burnout, as I mentioned earlier, I'm trying to learn how to cure my helium hands and also strategically say no more often. And I just want to just spend a minute on the imposter syndrome. Actually, Sian is the real expert on that topic. I will say, I want you to know that the feelings of imposter syndrome or self-doubt are normal. It's actually probably much more common than you think, particularly amongst high-achieving women. We know it also impacts men, but it can affect anyone. And even people who seem to have it all together, we all have some level of self-doubt every now and then. And honestly, it's a good thing. I mean, I was so confident, just one quick example, I was so confident when I came to Barnard that I almost failed out of organic chemistry, so, I think it's never bad to have a little self-doubt, but, the interesting thing is you have to learn from your setbacks, and Sian's research has shown that by simply writing down what you're afraid of, what your fears are, acknowledging them on paper, that can help you move past them. It sounds simple, but it's something that can happen. And similarly, reminding yourself of all the great things you've accomplished. You might want to reread an old letter of recommendation, review all of the accomplishments on your resume, actually make a list and a written record and take in and celebrate what you've accomplished to get you where you are. And also, and I'm talking to myself on this one, strive for progress, not perfection. We all want to live our best lives and be the best versions of ourselves, but we first have to accept who we are, our flaws and all, and not one of us is perfect. And you know what? Let's not forget, you made it to Barnard. You're a Barnard woman and a student, and while I haven't met you personally, I am confident that like many proud Barnard women who came before you, you will change the world. So I think you'll be good.
Well, I think that is a great note to end on. I think this whole idea that we have to have some compassion for ourselves and not hold ourselves always to this perfect standard is a fantastic reminder for us all. And I will say that everyone gets imposter syndrome, and the biggest correlate of imposter syndrome is success. So highly motivated and accomplished people doubt themselves sometimes, and that's okay. So I think, it's good to hear that and good to reaffirm that it happens to us all. Well, Dara, thank you so much for being here tonight. It really is so fantastic. We're so proud of you as an alum, and as Barnard turns out, amazing graduates and really a quarter going off into math and science fields and STEM careers. We're really so proud to see what you've done, and we hope you have more good news for us for a vaccine soon.
Well, I certainly, I can't take any credit for that. Our teams, though, are doing an amazing job, and we all hope that we have great news. So thank you so much for the opportunity, Sian, and thank you for your leadership and the great work that you're doing. I mean, I tell you all the time, even though you're not a Barnard alum, I won't hold that against you because you rock, totally rock.
Well, I really appreciate it. It's an honor to be leading this institution. And thank you all for joining us. I'd love to invite Dean Youngblood-Giles now from Beyond Barnard to say a few words about what's coming in the next Insight, and to wish you all a great night.
Thank you so much, President Beilock. And again, thank you, Dara Richardson-Heron, for joining us this evening. On behalf of the entire Beyond Barnard team, I'd like to thank all of you for joining us tonight. Before closing, I'd like to update you on a few things. Last week, we celebrated the closing of Summer Colloquium, an initiative that comprised more than 70 events between June and August. With more than 330 student and alumni participants, the Beyond Barnard team was proud to keep our community engaged during a challenging summer. We are now gearing up for an exciting slate of programs and resources during the fall semester. Current students can now sign up for our third annual Fall Opportunities Fair, featuring more than 50 employers and an equal number of graduate schools. You'll have the chance to connect virtually with a range of individuals from across disciplines and industries, all of whom are enthusiastic to recruit students from Barnard. We encourage alumni to sign up for opportunities to support and participate in our programs. You should have received an email from us asking for ways you would like to engage. If you haven't seen it, don't worry. Email us at beyondbarnard@barnard.edu. These continue to be extraordinary and challenging times, and we're here to support you. No matter where you are in your career, don't hesitate to reach out and let us know what you need to be successful. I hope that you will join us for our next installment of Insights, powered by Barnard, with Maria Hinojosa, class of 1984, on Thursday, September 10 at 6:30 p.m. Eastern Time. Until then, have a nice evening and stay safe.